Today's case, we have here Chibiba. She has a swollen hind limb, as you guys can see. And there's a couple of things that come to our mind whenever we see a swollen hind limb. First of all, we think about progression. When did this started? How did this started? What have the owners done in the past? They had treated it, tried to treat it, any diagnostics, etc. She has been treated in the past for it. So if it's not something that she hurt herself in a traumatic event. And there's 3 diagnostics that I absolutely have in the back of my mind. The first of all, which is one of the most that we see often on horses, is cellulitis. Cellulitis is an infection in the underlying tissues of that limb, and cellulitis can cause a lot of pain, a lot of discomfort. It can cause lameness, and then the swelling, pitting edema. Therefore, we want to rule out that from other things such as vasculitis and lymphangitis. So vasculitis is basically a disruption of the vessel walls, and what that disruption causes is that there's not a good drainage on that limb, and it can cause inflammation of the vessels. The other one would be lymphangitis. So the first thing that we want to do is a quick physical examination, a lameness evaluation. This patient thankfully is not lame and she's not in pain. Therefore, the first thing that we do after doing that physical examination is doing diagnostics to be able to rule out what, the difference in the differentials. Right now we did CBC, chemistry, SAA for Chibiba to be able to rule out her diagnosis. For CBC, everything was normal. What are we analyzing there? We're analyzing white blood cell count. If it's elevated, then it can indicate an infection, inflammation versus normal. So what that means is we're not dealing with an infection. Her SAA, serum amyloid A, also measures inflammation. She was within normal limits. That also indicates that she's not dealing with a severe infection. So right now, what we're gonna do on her, since we already did all her diagnostics, we're gonna put a sweat bandage on her, which is gonna help that limb sweat and start reducing inflammation.